Doctors spend more time entering data into EHRs than with patients. Yet all those terabytes of healthcare data haven't improved clinical outcomes, lowered healthcare costs, or improved experiences. It's clinical evidence, not data, which achieves repeatable outcomes, lowers healthcare costs, and supports patient-specific treatments. Such evidence is longitudinal, integrated, and captured at the point of care, where it's the most difficult to obtain in a reliable, verifiable manner. That's why InCytes was built by clinicians for clinicians, to capture and exploit true clinical evidence. To get the right answers, you have to ask the right questions. InCytes includes peer-reviewed libraries of custom treatment paths, which cover an ever-expanding range of pathologies, procedures, and products. With the help of our team, the clinician can use, modify, or create their own assets, then securely delegate to team members and patients where diverse evidence sources are integrated and made immediately available to them. The InCytes Report Builder converts captured evidence into engaging formats. Users navigate through results, educational materials, and benchmarks, building the right report. Captured evidence is also available in Excel. When two or more clinicians wish to selectively and securely share information, they form a circle. Circle participants achieve evidence-based goals faster and more efficiently, and can collaborate across institutional or national borders. Third-party institutions can also form circles, connecting their customers, members, or providers in the pursuit of evidence-based medicine. So don't just collect data. Start capturing and exploiting clinical evidence. InCytes.